be honest with me. Do you go to the doctor? A lot of people who don't, for whatever reason. Don't go to the dermatologist. But for whatever reason, they do go to a dentist regularly to get their teeth clean, get that 6-month checkup. And because of that, more dentists are noticing things that are kind of out of what would be their normal realm, and I'm talking skin cancer and cosmetic issues. Joining us now is Dr. Scott Wagner, a cosmetic dentist, and you're going above and beyond. Good to have you here on the morning show.
Thanks for having me.
It kind of sounds incongruous, a dentist who also watches out for dermatological issues, but if you think about it, while you're working on a patient, I mean, you can see skin problems.
Well, the first thing, obviously when you're, first thing we do is we go through a very comprehensive medical history. And I'm sitting right in front of the patient. So it becomes part of my normal routine. I'm checking somebody's face out, I'm looking at their skin, I'm noticing if they're sunburned, if they've got, burn spots, if they've got things that look like freckles, or is that a mole? Is that something that's a basal cell carcinoma? So my mind is always going, even if they don't know I'm thinking about that.
And we've got some pictures to show you some of the things that Doc may see while you're in his chair that show that there's perhaps a skin cancer or a melanoma or something that needs, a little more attention. Now, when you notice this, what do you tell the patient? How do you approach it and say, okay, I know I'm filling your cavity, but we got to talk about this?
Well, this is one of the unique things I think it's fun to be able to add to a practice. And this is a piece of technology called the Canfield Revealer. And what this does is it allows us to at least start the conversation about skin. It allows us to talk about, I've got an esthetician on my team, so we can proactively say, here's a piece of paper showing these pictures that we just took. It's kind of an interesting piece. It's got a glowing blue light on it. So it's, wow, what's this? Nobody has that at your average dental practice. So it allows us to talk about, if they pull up that picture again, you can see there's a red tinted picture, and there's also a brown tinted one. And allows us to talk about, the brown one allows us to see melanocytes and the depth of that. So you're going to see chronic sunburns like the one on the right side of the picture. That is the skin damage. The one in the middle, these are vascular lesions. So whether you've got rosacea or some other things, this is Shelby. This is my esthetician. She just got done with her second pregnancy. And you'll notice across the bridge of her nose and under her eyes and above her upper lip, that's called melasma. That is called the pregnancy mask. So that's one of many little conditions that we can at least open the conversation. What can we do to help your skin? And
it's all about overall health. Now,
absolutely.
You've got a number of products too, and you and I were chatting. I said, well, it's kind of interesting that you've got these products. You said, well, they're all medical grade. And basically, you got interested in this because you went on a popular website to buy something, bought a sunscreen or whatever, and realized something that was kind of disturbing about it.
Well, I'll say that we started doing our research, and this is a classic example. This one right here, we just bought last week on one of
a
website, yes. Don't want to get anybody in trouble. And the expiration date is literally 1 month from today.
Yeah, it says 10/15 on it.
Right, got a great deal on it, but we wanted to prove it. I was going to try and open it here in the live on camera, but it didn't work out that way.
But you're going to get what you pay for. So if you go medical grade, you're ensuring, as the person who's dispensing these, that number one, they've got a decent shelf life. Number two, is there a big price differential?
Well, obviously there's a difference between cosmetic, over-the-counter stuff, there's cosmeceutical at some of the higher-end stores, and then there's medical grade. They may have all the same components, but the reality is a medical grade is going to have extremely high percentage of the effective medication. So the stuff that's over the counter, you may get a small effect, a benefit.
What they call the active ingredients.
Right. Yeah. So the active ingredients are just going to be in a lot higher concentration. These are all peer-reviewed. They have clinical studies to back up what they do. And I felt it was my obligation, if I'm going to sell something, I only want to sell the best. My wife uses this stuff. We have lots of friends that use it. My mom uses it. So it became a natural progression of the office. If we got an esthetician and we're evaluating the skin, we're looking for skin cancers.
And it's painful, like getting a root canal, if you get products that you paid a lot for and they don't work. Doc, thanks for being here.
Thanks so much.
By the way, if you want some more information about what services Dr. Wagner and his team offer, you can go to their website, Eccella.com. Actually, if you go to newsforjax.com and look under the Morning Show tab, we made it easy for you and set up a link. Jen?